Hi, this is Dr. Mapakshi. Today I'd like to talk about vitamin D. So vitamin D is a fat-soluble vitamin. So the importance of knowing which ones are water-soluble and which are fat-soluble is key to avoid any overdose and toxicity from too much. So water-soluble vitamins or B and C, these are safe to take. Even if you take too much, it's excreted in the urine, so it doesn't usually cause toxicity. Whereas fat-soluble vitamins, which are A, E, D, and K, those will build up in the body. The longer you take, the higher the levels can get to, and so toxicity can be an issue. So I would recommend talking with your doctor before you continue these vitamins for long term. Vitamin D is one such fat-soluble vitamin, and most of us are deficient in vitamin. So it can be produced in your skin with sun exposure. No sunblock, with arms and legs uncovered. With sun exposure, you can make up to 10,000 units per day. And any SPF above 15 blocks 100% of vitamin D production in the skin. And again, the time of sun exposure, the amount of skin that is exposed, uncovered area of skin that's exposed to the sun, these are two things that would determine the amount of vitamin D production. So vitamin D is naturally found in very few foods. So cod liver oil is the highest source of vitamin D, followed by salmon. These two are the major sources. So vitamin D, we have a plant source and also an animal source. The plant source is ergocalciferol, and the animal source, we call it cholecalciferol. Both are equally bioavailable. They work similarly. So vitamin D is important for absorption of calcium and phosphorus from your diet. It is important for bone health. Vitamin D receptors are in almost all the tissues in the body, so it's important for immune function. It's important for proper cellular function, for hormone function. So it's very important to have good levels of vitamin D. In the past, all our ancestors and even our parents' generation had very good vitamin D because they spent most of their day outside. Whereas we predominantly have desk jobs, and so the sun exposure is quite low, and that is one of the reasons why most of us are vitamin D deficient. So you can take vitamin D supplements. So there is vitamin D3, which is the cholecalciferol. Vitamin D2 is the ergocalciferol. And you also have a combination of D3K2. So the reasoning behind using this supplement is the K2 directs the calcium to go into the bones instead of causing soft tissue calcification. But usually any vitamin D that you take is going to improve your overall bone health. There are certain foods that are fortified with vitamin D, like orange juice, milk, breakfast cereals. They do have some vitamin D added to them, so that's another source through which you can get. But again, like I said, fish liver oil, fatty fish, liver, organ meats, egg yolk, these are the majority of these are the foods that have vitamin D in the highest concentration. Sun-dried mushrooms are also a very good source of vitamin D. That is also, it's very high, it has a very high content of vitamin D, especially vegetarians, who don't eat fish and eggs. That would be a very good alternative to get adequate vitamin D naturally. But supplementation is what is recommended for most of my patients, because I see levels as low as under 10. So it's really important. So most of the laboratories say minimum, you're deficient in vitamin D if the levels are less than 30. But I would say the ideal vitamin D level is between 50 to 70. So you don't want it closer to 100, because that's when you would see the risks of, side effects of toxicity that I was mentioning earlier. So if you're between 50 and 70, that is ideal. It gives you adequate calcium absorption. Parathyroid doesn't get stimulated when you have enough calcium. Parathyroid levels can go up if you're vitamin D deficient, because you're trying to get calcium one way or the other, and parathyroid hormone maintains calcium at a very steady. So these are some of the information that would be helpful. So definitely ask your doctor to check your vitamin D and continue supplementation till you reach ideal levels.